A very warm welcome to today's European launch of the 2021 Lancet Countdown report. In the next 90 minutes, we will learn about and discuss new findings of the Lancet Countdown report in the European context and discuss policy options in the European region. My name is Micah and I'm the Managing Director of the German Alliance on Climate Change and Health in Germany and a new yet to be established think tank in Berlin. This event today will bring together leading academics and policymakers with wide-ranging experience and expertise. With the event, we aim to inspire, inform, engage, and energize a European audience interested and engaged with climate change, public health, research, and policy at this pivotal juncture in time. We also want to focus on and discuss the European implications of the new global Lancet Countdown report, as well as the European responsibilities. We also want to discuss the Lancet Countdown European Union policy brief and its recommendations. And of course, we also want to inspire you as the event attendees into concrete actions. Before we start and before I introduce our keynote speakers, some words on housekeeping. We will start off with 3 short keynote speeches, followed by a panel discussion on climate change and health in Europe with an outstanding panel that I will introduce to you later. You can engage with me and with the panelists by sending questions in the chat box, and I will then pick them up. In the end, we hear closing remarks by Dr. Rachel Löw, but before we are not there yet, in the end, we will start with our opening remarks by the first one coming from Dr. Elena Wisna-Malinowska. She is currently the head of the Climate Adaptation Unit in the DG Climate Action of the European Commission. She has worked for 13 years in the European Commission in different positions, such as policy officer in the Secretariat General, and she dealt with environment, energy, mobility, and climate policies. Elena, we are very happy to have you here. The floor is yours.
Thank you very much. And first of all, I'm not a doctor. I have corrected that. I have just the Juris Doctor title, which means, which is not fully the same as the PhD. So just to say, I'm not a doctor, so that's not to raise huge expectations. Good afternoon to everyone. Thank you very much for inviting me to open the European launch event of the Global Lancet Countdown report for 2021. I'm really honored. It's not the first time, and I'm really happy always to be with you. Yes, the publication of the first Lancet Countdown report tracking progress on health and climate change was only 5 years ago. And yet, within the very short time frame, you have managed to turn the publication into your annual reports in expectation and regular milestone for everyone working in the field. Bravo. Yet I would argue that the launch of this year's report is special. Why am I saying this? Well, it's more than the simple fact that your report celebrates the 5th anniversary, but for the following 3 reasons. First, the growing momentum in the health professions engagement with climate change has created waves, and the climate and health agenda seems to have reached a high level of political urgency and engagement. Well done. We see this, for instance, in the decision of the World Health Organization to organize the climate conference, the 2021 global conference alongside the climate change conference in Glasgow, and to focus it to health and climate change. We also see it in the first deliverable of the EU adaptation strategy, which was the European Climate and Health Observatory. We launched it this year, this March, and the Lancet Countdown is an important partner in it. My second point is that the EU climate policy has made significant progress in 2021, setting a new context. Europe will spare no effort to become the first climate neutral continent in 2050. The ambition is set in the European climate law, and we all know benefits of a clean energy decarbonized economy. Yet, in addition to that, the climate law also gives continuous progress in adaptation to climate change a legal duty for the relevant institutions and member states. And this is an important new element and potentially very far-reaching tool. The new strategy on adaptation to climate change is our ambitious plan to deliver on this new legal duty to adapt by making the adaptation more systemic, smarter, and faster. Preparing for the climate crisis also means preparing for the looming health emergency, because a number of specific threats are linked to climate change, like heat stress, like emerging infectious diseases, food and water safety and security problems, or even mental health impacts. I would even argue that health is an integral part of our European adaptation strategy, because failure to prepare for climate impacts in basically any sector will ultimately harm our health and well-being. So this new adaptation policy context will therefore further increase the interest in data and knowledge provided by your reports. They are an essential resource for informing Europe and national policy making, for monitoring the situation and for evaluating policy outcomes. Thirdly, and finally, the European Union health policy context has made great strides too during this year. The COVID pandemic has shown the need for coordination among European countries to protect people's health. In addition, it has thrown in sharp focus the importance of health threat prevention, response, and preparedness. And the Commission is therefore building a strong European health union to protect the health of Europeans and to increase our capacity to respond collectively to cross-border health crises. So much work has been done mostly on putting structures and coordination at EU level in place, revised mandates for the European Centre for Disease Prevention and Control and of the European Medicines Agency, and the launch of the new European Health Emergency Preparedness and Response Authority. With these and other measures, the Commission will improve our toolbox for managing future health threats. And this will include also projected health threats related to the climate crisis. So wrapping it all up, climate and health agenda have climbed up the political ladder, and both the EU climate policy context as well the EU health policy context are more conducive to this agenda than ever before. I hope these 3 points indeed explain why this is a particular year for the European launch of the 2021 global report of the Lancet Countdown. And there are more things to come, such as our packed work program for the European Health and Climate Observatory for next year, where we will develop dedicated European climate and health report, which we expect to publish next year, together with the Lancet Countdown in Europe. Let me therefore really thank at this occasion the Lancet Countdown for your cooperation on this project, and to thank also all other observatory partners for your contributions and your continued commitment. Many thanks again for having me and for your attention. And now I give the mic back to the chair.
Thank you very much, Elena, for these insightful key message to us. I hope you can stay with us and maybe also engage in the discussion later. Thank you very much. We continue with Dr. Nihir Dasandi, who is an associate professor in politics and development in the School of Government, University of Birmingham. His research broadly focused on the politics of sustainable development and human rights. He has been part of the Lancet Countdown since 2016, and he is the co-lead of the Politics and Governance Working Group on the Lancet Countdown in Europe. And we will be hearing you talk about new findings confronting the health impacts of climate change in the report of the Lancet Countdown. Nihir, nice to have you.
Thanks very much. I'm just going to share my screen with you so you can see the presentation. I think, is that showing up?
Yes, we can see it. Thanks.
Perfect. Thank you. So thank you, Micah. So my name's Nihir Dasandi. I'm based at the University of Birmingham, and I'm also one of the authors of this year's Lancet Countdown report. And I'm just going to provide a very brief background to the report, as well as a brief glimpse at some of the key highlights or the key findings from this report. And this year's report is called, it's entitled Code Red for a Healthy Future, which I'll come back to. So in terms of the Lancet Countdown, it's a collaboration, an international collaboration of 43 leading academic and UN institutions around the world. And it brings together over 120 climate scientists, health professionals, engineers, energy specialists, and social scientists such as myself. And we're split across 5 working groups. The first looks at the health impacts of climate change. The second looks at health adaptation. The third looks at the health co-benefits of mitigation. So it looks at mitigation actions and how they benefit human health. The fourth looks at the economic context, and the fifth working group, which I'm part of, looks at public and political engagement. And as you've already heard, each year we publish a report with a set of indicators, around 44 indicators in total across those 5 domains in the countdown. And this is the 5th iteration that has those indicators. And as I mentioned, this year's report is entitled Code Red for a Healthy Future. And so I'm just briefly going to talk about why that is. And the main reason for that title is because across the health impacts indicators that we have, we see worsening trends and rapidly worsening trends. And this is across all of the indicators, and it's affecting people around the world. We also find that it's particularly the vulnerable in society, and both globally and nationally, that are most impacted. So one of the things that we've done this year is disaggregate our indicators and our findings by the UNDP's Human Development Index, which I'm sure many of you are familiar with. And what we find is it is the most vulnerable around the world that are facing these the impacts most, in terms of food and water insecurity, heat waves, and the spread of infectious disease. And so what this is doing is reinforcing and increasing health inequities around the world. So when we think about climate change, often we think about the increase in heat, and our first indicator looks at vulnerability to the extremes of heat. It's a composite measure that tracks the proportion of a population that's over the age of 65, the prevalence of chronic respiratory illnesses, cardiovascular disease, diabetes, as well as the proportion of a population that lives in urban centers, in urban areas. And what we're seeing, again, so this is the graph shows you the trends across the different HDI groupings, so the Human Development Index country groupings. And actually it's in the very high HDI category that we see the greatest vulnerability, and that includes the majority of European countries. But in all 4 groupings, we're seeing an increase in vulnerabilities to the extremes of heat. If we look at heat waves, it's a similar pattern. So we're seeing increased exposure to heat waves. And this is particularly problematic for the very young and those over the age of 65 who are very vulnerable to heat waves in terms of heat stress, heat stroke, worsening heart disease, and kidney illness as well. So, and what we see from these graphs, I don't know if you can see clearly, is certainly since 2010, what we see is a really sharp increase in the exposure of vulnerable groups to these heat waves. If we look at wildfires, which is probably one of the most visible signs of the health impacts of climate change, we've seen some really strong images coming in the international media, particularly if we think about Europe this summer, we think about Greece and the wildfires there. But in the past few years, we've seen wildfires across Europe. And what we're seeing again is increased exposure to climate change is creating hotter, drier conditions, which is increasing the risk of wildfires, and the health impacts that come from that, which range from direct thermal injuries to the exacerbation of lung disease from smoke and pollution. And as well as that, it has the economic impacts and the negative effects on infrastructure and emergency services. And what we're finding is, 72% of countries have an increased human exposure to wildfires in the 2017-2020 period when we compare it to 2001 to 2004. The climate change is also, as I mentioned at the start, increasing the spread of climate-sensitive diseases, of infectious diseases. The graphs here show dengue, malaria, Vibrio, cholera, and Vibrio bacterial. And what we're seeing again is increasing trends. This is due to the increased temperatures, as well as the growing sort of humidity, which makes conditions more favorable for the spread of these diseases. And in Europe in particular, we've seen the increased environmental suitability of the transmission of dengue and chikungunya. It's increased by almost 60% since the 1950 to 59 period. One of the things that we find with the health impacts, I've mentioned the inequities, it's the most vulnerable around the world that are facing the most severe impacts. But what the report also highlights is it's not just in the health impacts, it's also in the response to climate change. We're seeing these inequities. So rapid decarbonisation would provide better health across the world. But what we're seeing is those in the wealthiest countries, so those with the highest HDI, that are enjoying some of these health benefits, whereas those in the most vulnerable places around the world are not. And we see this when we look at, for example, the energy systems that are used. What we're finding is, while there has been a decrease in, this indicator monitors the carbon intensity of the energy system, and it's the power generation sector, which is the large contributor to greenhouse gas emissions, and burning fossil fuels contributes to the majority of these emissions. And what we're seeing is, while there has been a very slow decline, a sort of 0.6% decline since 2014, 2018, the rate at which that is happening, we wouldn't meet the ambitions of the Paris Agreement, and it would take more than 150 years to fully decarbonize the energy system. And the issue with that is that the health impacts are already being felt for this sort of the carbonized energy system. If we turn to another one of our indicators, which looks at mortality from ambient air pollution, we see that it's 3.3 million deaths were attributable to ambient air pollution from human sources, and a third of these were directly related to fossil fuel combustion. So again, it's the lack of action on these things is having a direct sort of health consequence. And part of that inaction, or the motivation for that inaction, is often justified on the basis of the economic costs. In other words, it's this trade-off between the economy and the health sector. And what we find in our report actually is that that's not the case at all. So as I mentioned, the fourth working group looks at the economic costs involved with the health dimensions of climate change. And this indicator, for example, looks at the cost of health-related mortality. And what we're finding is, this is a huge cost we're bearing of inaction when it comes to looking at the health impacts. And in Europe in particular is the worst affected region when it looks at, this indicator looks at the health-related mortality, the costs of it. And the cost to Europe, it's the average income of 6.1 million of its citizens. So it's a huge cost to not acting on these things. So the other thing that we tracked briefly to wrap up is looking at, what is the potential, how are we going to see that change? And working group 5, we look at, political engagement, media engagement. And here we do see some reasons to be positive. We see increased media engagement with climate change and health around the world. So this looks at newspapers in a variety of languages globally. And we are finding increased engagement, but the question is whether, the pace at which this is happening. And just to wrap up, one of the key sort of insights from the report is, we do currently, with the response to COVID, we do there is this opportunity to respond in a way in which we do ensure a healthier future, but this does require action to take place quite now. And currently, what we've seen is with the $2 trillion committed to the COVID-19 recovery, only 18% of that would contribute to a greener energy system, a greener system. So really now is the time to sort of respond and to push for that change. So I will wrap up there. Thank you.
Thank you very much for your presentation. I'm sure we will, this will inform our future or our panel discussion later. Thank you very much, and I hope you can stay with us as well. We now hear the presentation of the Lancet Countdown policy brief to the European Union from Kim van Dalen. She is a GATE scholar currently pursuing a PhD at the University of Cambridge, where her research focuses on environmental metal pollution. She is currently working part-time to the Lancet for the Lancet Countdown as a consultant, and was the lead author on the policy brief she will now present. Kim, over to you.
Thank you so much, Micah. I'm just gonna try to share my screen. Is it visible now? Yes,
it is. You can see.
Thank you so much. Thank you so much for having me today. I will be giving you a brief introduction in the policy brief for Europe, which we wrote in collaboration with the Standing Committee for European Doctors, the European Public Health Alliance, and the Lancet Countdown in Europe. This was written in the backdrop of the COP26 and of course against COVID-19 recovery. And the briefing focuses on data and policy recommendations across 3 different teams, which were featured in the Lancet Countdown report. And this included heat and health in Europe, urban green space, and energy systems, air pollution, and health. So for the first team, we focused on heat and health in Europe. When we look at the 2021 Lancet Countdown report, we saw that vulnerability to the heat extremes continued to increase in the European region from 1990 to 2019, with the Czech Republic seeing the biggest increase of 12% in heat vulnerability in 2019 compared to 1990. And you can also see that when you look at this graph, that for all of the different European countries, heat vulnerability is going up from 1990 to 2019. So the recommendation that the policy brief makes is that we should protect human health from the adverse impacts of heat waves and high temperatures by adopting appropriate adaptation strategies and implementing heat health action plans, including measures that are outlined by the EuroHeat project. And this is a project that maps what kind of measurements can be taken to adapt to heat. And that includes, among others, things as the implementation of meteorological early warning systems, the improvement of health system preparedness and resilience, the improvement of urban and built environment, as well as heat health warnings that are based on the Temperature Health Association. So that is the first part and the first theme of the policy brief's focus. And the second theme is focused on urban green space in Europe. What we know currently is that almost 75% of the European population lives in urban areas, and it is expected to even increase more to about 84% by 2050. However, interlinked pressures from both urbanization and from the climate emergency affect people's health and well-being in various different ways. So there's a growing body of evidence that now suggests that different nature-based solutions, such as urban green space, can be implemented as a sustainable solution in cities to reduce the negative impacts of climate change in European cities. And therefore, the Lancet Countdown report assesses the urban greenness in different European cities in the recent report. So in the recent report, the 146 different urban centers were assessed, and these were all centers that had over 500,000 inhabitants or were the most populated cities in those countries. And you can see that also in this figure here, as well as in this bar graph. And what we saw there is that none of the European cities had very high or exceptionally high levels of green space coverage. And there were only 6 cities that had high levels of green space, and all the other 140 out of 146 European cities had only moderate low or very low or exceptionally low levels of urban greenness. So therefore, the recommendation that followed in our policy brief was that we needed to enhance city level climate change adaptation and mitigation whilst addressing urbanization challenges and promoting mental and physical health by increasing urban green space. And this can look like more parks, playgrounds, and for example, residential greenery. Our last theme that we focused on was on energy systems, air pollution, and health. So if we look again at the 2021 Lancet Countdown report, we saw that the carbon intensity of European energy systems has fallen slightly in recent years in both Eastern, Northern, and Western Europe, and you can see that here as well. Nevertheless, the progress was quite limited. So for example, when we look at the declines compared to 2017, we see only declines of 0.9% in Southern, Western, and Northern Europe, and only 1% in Eastern Europe when we look at 2017 compared to 2019. And something that is important to realize here, of course, as well, is that the burning of fossil fuels, of course, has an impact on air pollution, which is impacting human health. So what the Lancet Countdown also tracks is premature deaths due to air pollution. And you can see here that in total in 2019, it was predicted that about 480,000 deaths were estimated to be attributable to anthropogenic ambient air pollution in the World Health Organization region. So based on these facts, we made several different recommendations. And these recommendations firstly included committing to the reduction of long-term greenhouse gas emissions in line with the Paris Agreement, as well as the EU 2030 Climate Target Plan. And the second recommendation that we were making is fully aligning the revision of the EU Ambient Air Quality Directive standards with the new World Health Organization Global Air Quality Guidelines. And this is something that some of my colleagues will come back to in the panel as well. And our last recommendation was to develop policies that are based on integrated thinking, aimed at tackling the sources of greenhouse gas emissions and air pollution at the same time. Because when we think about the energy sector, this is really a prime example of the potential co-benefits by phasing out fossil fuels and switching to renewable energy sources, as the current use of fossil fuels is directly damaging human health, as well as aggravating the climate breakdown. So this transition needs to take place within the next decade for the European Union to reach its stated climate goals. And that was very short and quick an overview of the policy brief for Europe. You can read it as well at the Lancet Countdown website. And this is just an overview of the recommendations again. And with that, I'm going to give it back to Micah. Thank you so much for listening.
Thank you so much for presenting the very concrete and helpful recommendations that are also very helpful for countries like Germany and I think also others, and to inform their policy briefs that some countries are writing as well. Kim, maybe you can put the link to the global report and also the policy brief maybe in the chat box for everyone.
Yes, I will do that.
So we start now and go over to our panel discussion, where we want to look even further into climate change and health in the European region. We now hear very short statements from each panelist, and I will introduce each and every one of them to you before we hear their input. But it would be great for the panelists to look at and reflect a little bit on the results of COP26 in Glasgow, on the progress made or not made, and what this means for climate change and human health in their presentations. And if you have any question, please don't forget to type your question into the chat box. I will then pick them up later. And I would like to start with you, Martin, with Dr. Martin Balzan, who is a physician and currently the rapporteur for environmental health and climate change for the Standing Committee of European Doctors and the president of the Medical Association in Malta. Martin, please let us know what you brought with you.
So I am here as a representative of the Standing Committee to bring the support of European doctors to the Lancet Countdown initiative. Of course, I thank the organizers for inviting me for the third consecutive year. I will focus on air quality. Air quality, this year we had the World Health Organization issuing very solid evidence-based recommendations on what should be the acceptable levels of air pollution, even though in a, let's say, utopic world, there is no acceptable level of air pollution. And not surprisingly, these evidence-based guidelines, which were prepared with very well-known scientists, want them to go down, particularly the particulate matter, but also the nitrogen dioxide and the ozone. As regards our position, the standing committee just filled in the questionnaire and sent our position to the European Commission, because the European Commission is intending to bring down, to review its acceptable levels for air quality in Europe. And our position is what is perfectly aligned with what the Lancet Countdown is saying. They should reflect what the evidence is saying. That is what WHO is recommending. Now, just to explain a little bit, perhaps for people who are not technical, some people ask me, how can the exhaust of a car kill people? How can it kill people? How can a particle you can't see kill people? And this was explained partly by the representative of the Lancet Countdown. We have loads of vulnerable people who are very old, who have very sick lungs, who have very sick hearts. And as we've seen with the COVID epidemic, the first people who get affected with anything seriously serious are these people. So if these people are exposed to air pollution, you will get mortality, you will get death, because their body has very little reserve. Their heart and lungs have very little reserve. However, in most Western European countries, there is a prevalence of asthma between 10 to 15%. In Malta, that's about 15% of the population. And a lot of them are not old people, they are young children in their youth. And air pollution, especially the particulates, they make asthma worse. They make any respiratory disease, even emphysema and COPD. So the effect of air quality is very up close and personal. And I'm emphasizing it because many times climate change for the average citizen is something far away and not my issue, but this is very personal and immediate. But what is the link to climate change? It's very clearly stated in the Lancet Countdown summary that it's fossil fuels. Fossil fuels mainly from transport and vehicles. So they're producing the greenhouse gases, but they're also producing the pollutants. So there is commonality of cause. One thing which we feel strongly about and we support in the Lancet document is the green spaces in the cities. So we need places where people can exercise and develop their health, which are free from pollution. Otherwise, you go and exercise, and the result is that you get worsening of your respiratory condition or you get disease. So here we support the Lancet Countdown as well. Just to make one final comment, there is obviously in most EU countries a push to have electric cars. Electric cars have to be charged from somewhere. So for electric cars, they reduce definitely airborne pollution. It's not coming from the exhaust pipe under your nose. However, unless it's in parallel with increased renewables and decreased fossil fuels in energy generation, it will not affect climate change that much, even though the urban air quality can improve. So I conclude here. My message is the Standing Committee of European doctors supports the WHO guidelines, has written to the European Commission to implement them, and we fully agree with the points raised in this document by the Lancet Countdown on air quality and European green spaces and policies to reduce fossil fuels. Thank you.
Thank you very much, Martin, for presenting what you have been working on in the past year. I have a question. European doctors have been calling for stricter air quality standards in Europe, as you just have mentioned. What are your thoughts on the new guidelines from WHO and also the European Commission public consultation on air quality that's coming up?
So,
what are your expectations?
As I said, the WHO guidelines, they are purely a health perspective. That means they reflect the science. The science of what is the optimum, that level which is there, but which does not have health effects. And as I said, the scientific evidence is robust, and I know who are the scientists who have reviewed the literature, and it is very, very reliable. So we are telling the European Commission that is where to go. Now, normally in the European Commission, it's a negotiation between industry and the Commission. And we from the health side, obviously for us, ideally, would be no pollution. But with our starting point, at least CPME's position is that we go for WHO and we aim for the lowest possible. In our case, because we see and touch disease every day. I am a respiratory physician, so I see a lot of asthma. I see a lot of respiratory disease. One thing which we noticed, for example, during the COVID, is that air quality in the urban areas in most European cities during lockdowns went down significantly. Now, there are already studies which are saying that there was much less asthma. I can tell you as a practicing doctor that my patients were much better during the lockdown. You might argue that's because of the masks and the less social distancing, there were less viral infections. But we have to aim to have better air quality. Otherwise, our elderly and vulnerable will keep dying. Otherwise, our children and young people in productive activity will keep getting sick, and that affects the quality of life. So we need policies which promotes both better air quality and at the same time decrease the carbon footprint. So getting electric cars is okay, but we need renewables.
Thank you very much, Martin. We come back to you later in the discussion, but I would like to continue with Christina. Christina Precorp is a political scientist and junior policy manager for global public health at the European Public Health Alliance, EFA. Christina, maybe you want to give a short presentation on what you are thinking.
Yes, thank you very much, Micah, and hello, everyone. I will be sharing a few slides. Please do let me know in case you won't be seeing this right, but for a very short introduction, I'm delighted to be able to join you today on behalf of EFA. And for those of you who haven't met us yet or haven't had a chance to work with us, EFA focuses on policy and advocacy on public health, on a number of different public health topics with a strong emphasis on health inequalities. We are a people's platform for public health with a broad and versatile membership of over 70 organizations, from European umbrella NGOs to the smallest of grassroots local organizations. And one of the areas that we focus on is the intersection between social and environmental determinants of health, including the interplay between air pollution, health inequities, and health outcomes, in particular in the context of the transition towards clean mobility and clean heating. And that is what I would like to talk about in the next few minutes. And to start with, as an evidence-based organization, we naturally call for an alignment with the latest scientific evidence. And in the context of air pollution, as we've heard, these are the WHO updated air quality guidelines. Now, we've heard a bit about the content of the guidelines. To bring it back to the policy context, the EU has already had some rather ambitious goals for itself set out in the Zero Pollution Action Plan, which aims to have a reduction of 55% of premature deaths caused by air pollution by 2030. So we know where we want to be going, and we have the scientific basis to inform that journey. Now we need to be implementing that, and the way to do it is to have full and legally binding alignment by 2030 with the WHO air quality guidelines. That is the only healthy option that we have, and thankfully that is also an opportunity that we have with the revision of the ambient air quality directives, which is ongoing. However, we also need a broader policy framework and architecture that is aligned with our clean air goals. And that becomes even clearer if we look at the health and climate co-benefits from action in heating and transport, as has been mentioned already. Fossil fuels are an obvious threat to both of these, and therefore if we phase them out, we will see immediate and local health gains as well as global and long-term climate benefits. Unfortunately, we still need to consider the mirror image, the huge costs of inaction, of lack of ambition. As has already been mentioned, lack of action leads to costs in terms of expensive treatments, of hospital visits, but also indirect costs, such as losses in productivity, for example. And to continue with talking about money, we need to align our financial incentives with our values and with our goals. And this must spell the end of subsidies for fossil fuels, be they direct or indirect subsidies. Moreover, the transition cannot only be a clean transition, it must also be a just transition. And currently we have over 30 million Europeans who struggle to heat their homes appropriately, and energy poverty leads to respiratory problems and mental health problems. Therefore, we need policies that support these vulnerable groups and allocate funding dedicated to tackling the issue of energy poverty. And to conclude, I would like to say that we do have a challenge ahead of us, but it is also an opportunity to create a vision for a healthier, cleaner, and more just society. However, we need to bring together all these puzzle pieces, the science evidence, the health and climate considerations, as well as the other policy areas that impact climate and health, and have the right financial architecture in place. And I shall stop my presentation here and also stop the screen sharing.
Thank you very much, Christina. I have one follow-up question for you. I was wondering, in the urban context, how do climate change risks combine with other environmental issues pressure on human health in Europe? And what do you think, what urban adaptation action could be effective to address these risks?
Yes, thank you very much. Indeed, I've kind of mostly addressed the overlap between climate and health threats. However, there's an impact that has already been addressed from climate change directly to human health. We've seen the most obvious maybe example is on increasing temperatures and heat waves. And those are an example of where we can address the problem with, for example, better insulation, which in turn leads to also less energy consumption, meaning that we can address, and we need to have this integrative thinking where we address climate mitigation and climate adaptation issues together.
Thank you very much. I'm sure we hear more of this co-benefit designing in our discussion later. Let me continue with Dr. Alexandra Kazmierczak. I hope I pronounced that correctly. She is an expert in environment, human health and well-being at European Environment Agency, EEA, where she coordinates the European Climate and Health Observatory. Alexandra, over to you.
Thank you very much, Micah, and it's a pleasure to be here this afternoon. And it's always a pleasure. Well, maybe not a pleasure. It's actually quite scary to hear the results of the Lancet Countdown reports. But it's really, really important to make sure that this message gets as far as possible. What today really resonated with me in Dr. Dasandi's presentation is the subtitle of the Lancet Countdown Global Report, which is the Code Red. Code Red implies that there is a need for action, and there is a need for action now, and immediate action is needed to prevent the climate-related health risks. But yeah, the question is, are we there yet? Are we ready to act? Do we have the tools? Do we have the knowledge? In most of the situations, before we can act, we need some sort of set of rules. We need some sort of policies. And in many cases, we don't still have the knowledge that would support the development of these policies. I think that the new WHO guidelines on excuse me, on air quality are an example where this knowledge does exist. It's irrefutable. It's impossible to deny the impacts of air pollution on human health. But in terms of many of the climate change impacts, I don't think we're there yet. And that's why we have this recently launched initiative of the European Climate and Health Observatory, whereby the aim is to collect this knowledge, to present this knowledge, to develop new knowledge, and knowledge in a format that would be appropriate to the policymakers at various governance levels, to actually put it into the policy document so they can support the action on the ground. And as Elena Wisner-Malinowska mentioned in her presentation, it's one of the first actions of the EU adaptation strategy, and it was launched in the recognition that we still need better knowledge on climate change impacts on human health, and that we need a greater capacity to act. So what I wanted to emphasize is that the European Climate and Health Observatory is a portal that aims to develop and present the available knowledge on climate change impacts on health, but it's also a partnership. And I think it's a very important step in breaking the policy silos, in breaking the silos that exist in our heads, where we divide the health or the built environment and climate change, whereby we have a partnership that puts together different directorates general of the European Commission. We have DG Sante and DG Klima on board. We have European Environment Agency, European Center for Disease Control and Prevention, European Food Safety Authority, WHO Europe, of course, Lancet Countdown, as well as one of our key partners. But we also have, for example, Copernicus Climate Change Services and Copernicus Atmosphere Monitor Services. So what we're trying to do is to develop the knowledge in a collaborative fashion, and in recognition that not a single organization can hold all the knowledge, and that we all need to sort of put our bits together in order for the best and the most robust knowledge to be there and be available at the fingertips of the policymakers. So I think I will finish with that, and I would encourage you to visit the European Climate and Health Observatory. I can see that Kim very kindly put the link in the chat, and if you have any questions, if you have any suggestions what we could be doing better, please also contact us on the email address provided in the box in the chat. So thank you very much.
Thank you very much, Alexandra. I have also a follow-up question for you. Coming back to the knowledge, what do you think and what do you believe are the adaptation priorities to protect health of the European publications? Do you have that in the observatory as well?
In the observatory, with our partners, we developed an action plan for 21 and 22, focusing on two main health impacts from climate change. One of them is the impacts of heat, and the other one is the climate-sensitive infectious diseases. So we have this sort of balance between what is recognized as the biggest killer, and it's been emphasized in the previous presentations how vulnerable the population in Europe is, and we also focus on the sort of more emerging on unknown risks. So yeah, I think that the simple answer is that we need to adapt to all the threats that, you know, the present ones and the ones that are only coming up in the next decades. But I think that indeed adapting to heat and making sure that all those excess deaths that are happening every year during heat waves and that are completely preventable through the actions in our built environment, through the greening, through the improvement of housing, through the health alerts, as been mentioned, are actually implemented. But I think there's also a lot about awareness raising, and here may be a bit of a segue to Rana's intervention, the education and training of the health professionals, raising awareness among the public that maybe it's not a good idea to go and sunbathe if you're 75 and have heart issues on a hot day, and and making sure that all the sort of practitioners and policymakers and the general public are aware of the risks and that they are able to take care of themselves and take care of others.
Thank you very much, and also thank you very much for building the stage for Rana. Rana is the next one. Rana Orhan is a public health expert in the Association of Schools of Public Health in the European region, ASFER, where they focus on training and preparing the current and future of the climate and health workforce. Rana, over to you.
Yes, thank you. Good afternoon, everyone. I'm Rana. I'm a fellow at the Association of Schools of Public Health in the European region, let's say ASFER. And ASFER is the key independent European organization dedicated to strengthening the role of public health by improving education and training of public health professionals. So that's what I'll be focusing on. And we represent over 100 faculties throughout Europe. That's Europe in the sense of the WHO definition. So we have members from Iceland to Kazakhstan. But let's cut to the chase. What we basically saw in the last almost 2 years during the COVID pandemic is the importance of a health workforce that's ready to address major public health challenges. And the climate crisis is, it's the biggest health crisis that's currently already asking the health workforce attention. We saw that with the floods in Europe, the heat waves that we just talked about, but also other direct and indirect effects that we will see in Europe which we are seeing now, and we will keep seeing them in the following decades. So we need to be prepared, and we need to be able to respond quickly to these challenges. And in order to do so, we need the future health workforce, but also the current health workforce to be trained in climate and health. What we see is on the front line, but also those who work in public health on, let's say, the background, so more the policy side of things, is that they need to be there needs some improvement of collective understanding of climate and health. So that's what Alexandra also just said, raising awareness, but also really having some skills to be able to communicate, for example, in an evidence-based manner and efficiently with other stakeholders. What we saw in research from 2020, this research from the US, is that there is an actual growing demand for public health graduates with training in climate and health. And hopefully this year, we will be able to do this research for Europe as well and show this demand here. So what we did at ASFER is also in 2020, we did a survey among our member schools, so in Europe, and we asked them about what they are currently offering in terms of climate and health education. What we found is that a small majority offers something, but it's ad hoc and it's quite insufficient to say, so frankly. And it's mostly efforts of individual students or individual teachers, faculty members that contributed to these offerings. What we also saw is, because we didn't only ask about education, we also asked about other aspects where you could take some action, let's say. And one of those were the vision and strategy of the faculty or the university. And we saw that anything remotely related to climate and health was not in there as well. So that's a bit, well, to say, a bit disappointing in the sense that universities and especially public health schools have a key function in society and have to lead change, and they bear a great responsibility. So trying to wrap up, what we need is expanding public health education and training. We need this so people can address climate change. We need to improve the infrastructure to meet anticipated needs. And we need to also train the current workforce, because those are already there. They will be working there for decades, maybe, in most cases. So we need to make sure that they are also retrained to be able to address those needs. And I think what we try to do from ASFA's side is trying to facilitate this process, but it really needs everyone's input, because as we saw with COVID, it's not limited to schools, it's a bigger societal issue that we have here. Thanks, Micah, over to you.
Thank you very much, Rana. Very interesting. And just to add this, we did a similar but way smaller investigation in the German system, and completely mirroring your results, that there is a lot of room for and a lot of potential, but not yet used. I have also a question for you. What are your thoughts on how schools of public health in the European region can best support the goals of the European Green Deal through its networks and schools of public health and departments?
Yeah, so what ASFA could do, let's say, so ASFA would be the network, and we have the member schools, but of course there are schools outside the network as well. But what an overarching network as ASFA could do is develop educational offerings or really facilitate this process. So through our survey, we identified some barriers. We saw barriers in implementing climate and health education. And what we saw is that schools really do want to do something, but they had the lack of available staff, lack of funding, or time, or they didn't know where to put it in the core curriculum, or they didn't have expertise or materials. So what we try to do with ASFA is try to get these barriers, or take these barriers away, so schools can implement this. A recent example is the list of core competencies in climate and health, which could be used by schools to inform their curricula and training for public health professionals. Or another example is developing actual educational programs, which we'll take on following year, hopefully, so schools can, so we can literally unburden schools and directly reach who they're also trying to reach. So, and another role, and that's also something to mention because we're in the European context, is taking this beyond schools. So we work together with the European Commission and many of NGOs. I saw some familiar names in the participants list as well, is working together in the thematic network of the European Commission on the platform. And with this network, we will produce a joint statement on this particular topic. So it goes beyond, well, next to action, we also need some advocacy, right, to get the action done.
Thank you very, very much. Just a quick reminder to the audience, you are very welcome to type in questions into the chat box or the Q&A. And I unfortunately have to inform you that Dr. Anne Stauffer, Deputy Director from HEAL, Health and Environment Alliance, can't be with us because due to sickness. I hope it's not COVID. So she can't be with us, but we continue with Dr. Rachel Löw, who is Director of the Lancet Countdown in Europe and Associate Professor and Royal Society Dorothy Hodgkin Fellow at the London School of Hygiene and Tropical Medicine. Rachel, over to you.
Hi there, Mighty. Thank you very much. Can you hear me?
Yes, we can hear you and see your slides as well.
Right. Wonderful, thank you. So it's a pleasure to be part of this event, and congratulations to all the authors of the Global Lancet Countdown report this year. I have the pleasure of introducing the Lancet Countdown in Europe project, which is a new initiative that we launched in September this year. So we are a transdisciplinary research collaboration monitoring the progress on health and climate change in Europe, and particularly focusing on the challenges of the region working in collaboration with the European Environment Agency and other partners to provide policy relevant indicators for the European Climate and Health Observatory and to serve the policy needs of decision makers in Europe. So we are the newest member of the Lancet Countdown family. So we will be working alongside the Lancet Countdown Asia, the Lancet Countdown South America, and the Lancet Countdown Small Island Developing States, where we hope to share our regional expertise and develop indicators in collaboration and learn from each other and to develop indicators to face the different challenges we are all facing from climate change. So our focus in the first instance will include the European Environment Agency member countries and associated countries, and we are hoping to expand as our collaboration develops. So our team is currently comprised of, we have a chair, Maria Nilsson, a co-chair, Josep Maria Anton. I'm the director of the project. We have Kim van Dalen, who is our European consultant. We're joined by Marina Romanello, who is the lead author of the Lancet Countdown report this year. We have our 5 working group leads. So our project very much mirrors the global initiative, where we're focusing on impacts, exposure and vulnerability, adaptation, mitigation and co-benefits, economics and finance, and social and political engagement. And we're also joined by 2 advisors from the World Health Organization, the Europe office, Dr. Oliver Schmoll and Dr. Vladimir Kendrovsky. So our first publication outlining the framework of our new initiative was published in September in the Lancet Public Health on tracking progress on health and climate change in Europe. And the goal is to develop these region-specific indicators to address the main challenges and opportunities of Europe's response. So as Europe is one of the largest current and historical emitters of greenhouse gases, and it's also one of the largest providers of financing for climate change mitigation and adaptation, the response of Europe really is crucial for human health and for the health of the planet. So Kim gave a very interesting presentation of the policy brief that was prepared for Europe this year, focusing on these the key areas that were identified, and we are also working in collaboration with the EEA to make sure we are targeting their key priority areas, including heat health, infectious diseases and extreme events. And we welcome collaborators to join us to contribute evidence-based policy relevant indicators. So please do get in touch. You can contact us via the website or our email address, and we would love to hear from you. So thank you very much.
Thank you very much, Rachel. Very inspiring also for the country level to learn what you are preparing and doing at the European level. I also have one follow-up question for you. The Lancet Countdown in Europe is one of the regional centers developed under the Lancet Countdown. How do you envision the collaboration between different centers to look like?
Yeah, so we would be interested in using the knowledge across the different regions to see how we can adapt indicators due to specific circumstances. So, for example, looking at techniques we can use to downscale indicators for particular cases, for example, working with our partners in the small island developing states, countries, to make sure that we can really make use of these global level products and downscale them so they are relevant either to, for example, in the setting of small islands or in cities or in these particular hotspots, these climate change hotspots that are particularly vulnerable. We'll also be looking at joint initiatives for dissemination and policy engagement, and making sure that we are having a global perspective but able to apply that knowledge at the local and regional level.
Thank you very much. Very insightful. I understood that you have to leave, unfortunately. So we continue with the rest of the panel for question and answers. Please, to the audience, please keep sending in questions. I will now start to pick them up, and I have them here on my second screen. The first question I have here, I read it out to you, and I think it was raised at the time Martin was speaking. Some environmental scientists and physicians claim that fossil fuel combustion and air pollution is not a perfect analogy. In which way and to what extent is it, and is it not? Thank you. Martin, would you like to start? We can't hear you yet.
So if I understand the question well, basically, if air pollution coming out of a chimney in a distant power station, which is far away from cities, will contribute more to global warming, to climate change, than to urban air pollution. However, the car parked in front of your front door, which uses fossil fuels, will produce PM10s, PM2.5s, the chemicals which are within the PM2.5, the ozone, the nitrogen dioxide, which are bad for everybody's airway. So the main problem of urban air pollution is vehicular traffic. Globally, it's not just vehicular traffic, it's power generation as well. If you go to countries of low income, and I mean outside Europe, a lot of people use wood or charcoal for cooking. So you get a lot of much more indoor air pollution. It's still a fossil fuel, it's charcoal, it's wood, and it's in your room. So it's affecting you much more than the coal power plant 10 kilometers away. But yes, the pollution, which is bad for our health, is coming from fossil fuels. There are other sources, chemicals and certain industries, but it's not a perfect parallel, but lots of studies indicate that vehicular traffic and any level of PM2.5 is associated with mortality and with worsening of respiratory disease.
Okay, thank you, Martin. So this makes us think even more and very differently about mobility then. Thank you very much. I have another question from my colleague Dieter Lehmkuhl in Germany. I read it out. The importance of developing policy of integrated thinking was stressed. What about the governance of implementing those policies? Is the present governance structure fit for purpose, and what needs to be done? Alexandra, maybe that's a question for you. Do we have the governance structures in place to deal with the crisis situation we have?
I think that there is a general recognition about what I mentioned already about the sort of clear separation of policies into health and climate change and environment and so on, that it clearly doesn't work. And what we see is that it's becoming sort of merged together, and new forms of governance emerge. And I'm actually looking at my notes because we are now looking into the doing some analysis of the national climate change adaptation strategies and national public health strategies for the EEA member and collaborating countries. And actually, one of the frequently mentioned actions is setting up new working groups, cross-cutting groups, new governance structures within different ministries, within different agencies, to make sure that the subject of climate change impacts on health is tackled in a coherent way. And I think actually Germany is one of the early starters in this respect, that there is a new unit focused on climate change and environment in the Ministry of Health, as I understand. So that's one of the examples where a new structure was created in the recognition of the need to bring these two thematic areas more closely together in order to have a more effective policy making processes and more effective and efficient policies as a result of that.
Thank you very much. Super interesting. Also my field of research. So let's keep talking about this. Christina, Rana, is there some reflections you want to share on governance? If not, I have many more questions. Don't worry.
Well, I just want to add that in the Netherlands, there's also going to come a group on climate change and health within the Ministry of Health. So I think that's a development we see in other member states as well. And that's again why we need to focus on the workforce, on education and training to get back to that. Because without education and training, we can't get the proper people in those ministries. And I think that's really, really needed, or at least to contribute to the research that's available and to the skills that we need in those ministries.
Thank you. So I continue with the next question, which is quite long, and I will read it. Most of the recommendations coming from a scientific perspective, including the current Lancet Countdown policy brief, are about problem and targets. Rarely, however, there are concrete proposals for action. Therefore, I would be interested to know if there's any kind of recognized best practice list of demands that needs to be implemented in order to achieve the climate goals in Germany, Europe, or even globally. Or is that the knowledge gap mentioning before, making it hard to derive those actions? Who wants to start? Please, Alexandra.
Yes, I would completely agree that it's one of the biggest knowledge gaps, I would say, how effective different solutions are and whether the same solution is actually effective in the same context. We know, for example, that looking at the example of France, that was affected very severely by the excess mortality during the 2003 heat wave. We could see that in the recent years during the heat waves, the mortality was much lower. It was a sort of fraction of what happened in 2003. So clearly something has been done about it. And a lot of measures were implemented, but it's very difficult to say, is it the early warnings that work? Is it the greening of the city? Is it district cooling systems that are being implemented? Is it the improved quality of housing? What was the main reason why this mortality actually decreased so substantially? So I think that it's definitely a knowledge gap to be able to distill what works and what works in which context. But I think at the same time that there's plenty of actions where we can see benefits, and these are the sort of no regret actions. And improved housing, you know, living in a better insulated house is good for a lot of things, not just the sort of creating the barrier between the climate and the people. Putting the greening in cities and trees, so many physical and mental and social health benefits that are derived, that definitely it won't hurt, and you know it will bring other benefits. Urban sustainable mobility, enhancing the infrastructure for walking and cycling, and so on and so on. Actions that can reduce the exposure of the population to different climate hazards, that can decrease their vulnerability and have other co-benefits. I think that's where we actually can't go wrong.
Thank you very much. I think I've seen Martin's hand raised very quickly. Do you want to come in?
Just about heat waves, you know, at least Malta, we're on top of the list of the Lancet Countdown. So our level of, we're used, first of all, our bodies are used to them, so that because it's hot all the time, you understand? Our bodies are acclimatized. But then the public health is highly organized to warnings and tell people, radio, television, what to do and what not to do. And then infrastructure, that we have air conditioning nearly everywhere, and or fans if you're not that rich. But again, when there's a heat wave, you get the biggest peak in electricity. So that's where fossil fuels come out en masse. And so this is one aspect. The other thing is the infrastructure that many times we used to have grid failures. Now, there are less, because when there's a heat wave, your infrastructure, if everybody's buying air conditioners, you need to have the whole electricity infrastructure. So although we're on top of the list, our mortality is amongst the lowest from heat waves because we are prepared. So I think, what can I say? I cannot quote a clear scientific study, but it's very tangible.
I see that Malta is a good case example on best practice on adapting to heat waves, and I think we need more of these. I listen to you, and I think we need more of this best practices as is demanded in the question. Where's the list of best practices that then fit into different contexts? Thank you very much. Alexandra, I have another question for you. And also, of course, the others, if you want to come in. Is there a direct link to the recommendations for air quality and infectious diseases in the observatory?
Yes, I'm not quite sure if I understand the question fully. Just to maybe explain that the European Climate and Health Observatory is looking at the climate change impacts on health, but it does not investigate the health co-benefits of climate change mitigation and then reduce the use of fossil fuels. So in terms of the air quality, we're at the moment developing a set of pages that would look how the air quality combined with the climate change is likely to have health effects, or is having health effects currently, and it will have in the future. And as such, the observatory also doesn't really offer recommendations. It's meant as a sort of knowledge hub to support the policy making rather than making the direct recommendations for action. So I hope it answers the question.
I hope so too. To the person who raised the question, if Alexandra should explore even more, please let us know. Rana, I have a question for you. Do you think we need more PhD studentships to examine the interface between climate and health sciences and policy development and implementation? If so, who might fund this research in the interface between science and policy?
Yeah, that's a good question. I mean, that's for the first part, yes, definitely we need more PhD positions. For from PhD, we just need more research as well. We need to take, for example, when we look at the science part and policy factors such as climate justice, equity, those are also themes that we need to take into account when we develop policies. And well, of course, we need science to back that up. If anyone knows an interesting PhD one, there's a young public health professional here. Who might fund it? I think that's maybe also a question. I heard Alexander saying the observatory is a knowledge hub. Is it also a place where we can create funding opportunities? I think for ASWA's side, I can only say that this is something we need to address with the thematic network. We need to explore what this means for funding. Or maybe Alexandra can come in here.
Yes, please. Alexandra, do you have funding ideas?
Well, I wish that we could offer funding, but sadly we can't. However, there seems to be plenty of funding coming from the European Commission under the Horizon Europe program. There is a lot of funds related to climate change, a lot of funds related to health, and some funds related to the overlap between climate change and health as well. And I think only in September, one of the calls for research projects in the area of climate change and health closed, but I'm sure that there will be other opportunities for research funding, and also other funding streams like the life projects, which are a bit more about the implementing of the actions rather than the base research as such. They touch upon the subject of climate change and health.
Thank you very much. But I hear that funding is an open point, something we have to explore even more. So if there are funders in the audience, please raise your hands. I come to the next question, which I find very interesting. And maybe Christina, you can come up first if you want. The question is, does the panel think there should be a health independent non-governmental organization grouping at COP27 to formalize health inputs to the COP? If so, who should lead this?
Yes, thank you. I think the importance of health was already recognized at COP26, and there was a really an excellent COP26 special report on climate change and health, and that was already quite promising. However, indeed, we've seen throughout the whole panel, this is something that we have discussed, that we need to integrate these two further. Therefore, this type of development would definitely be welcomed. If I may just very quickly come a little bit back to that question on the knowledge gap.
Sure.
Thank you. Because I wanted to just add that I agree on the one hand that we have some knowledge gaps in a number of areas, and one of them that I wanted to highlight was indoor air pollution and what exactly the levels in European homes are right now and what should be done, what the impacts are, and how we should tackle this maybe in a more coherent way at the European level. However, on the other hand, also IFA does have a number of specific recommendations related to fossil fuels. One of them is banning and phasing out internal combustion engine cars. And the other one is a ban on fossil fuel boilers. Within this decade, we think it is feasible, and we think that is something that would have clear benefits for health and climate.
Thank you very much. I would like to come back to the question of how should the next COP should look like, and what are your expectations, and also if we need a interdependent non-governmental organization on health. Maybe each and every one of you again, because we are almost out of time, maybe that's the last round. Martin, would you like to start? What are your expectations for the next COP, and do we need this kind of group?
I think at COP, it's the governments who are taking the decisions. Although it's good to have a voice there as well, I think the governments go there with already a preconceived idea of their negotiating position. So probably the lobbying has to be done in a concerted way, everybody on his national government. Okay,
and prior to the COP?
Prior, I think the coordination of national organizations, environment oriented, or if it's the European Union institutions, instead of European Union NGOs like us, and within to influence the European Commission, I think that would be more effective. Now, you have still the problem of undemocratic countries, you have which are not susceptible to this sort of lobbying, So that is not easy to solve.
So would you agree then that we need this kind of group not only for COP, but also in between COPs, working on European issues, but also national issues?
Cooperation always helps, you understand? Cooperation, but if it is targeted to a goal, it will be more effective. But then if you diffuse your energies on too many objectives, then it becomes counterproductive.
Agree, totally agree. Rana, what are your ideas?
Well, for this question, I'm not sure myself. I'm also kind of a COP newbie. Last COP was my first one. What I did see was a great movement of health organizations and health advocates. I remember someone saying in one of those meetings that this was the biggest group they saw. But I think what I'm hesitant about is is it more effective to have a separate group, or do you need to integrate health in all those other areas? So maybe do you use health as a frame only, or do you use other frames to bring your health stuff in there? So that's my thought. And for next COP, I would say let's keep up the momentum, but also demand more, and let's go for more. So after next COP, people get maybe less disappointed and have more hope for the future.
Thank you, Rana. That's actually an interesting thought. Do we need a group for health, or do we streamline health in all the policy areas? I think that's worth a discussion. Alexandra, would you like to come in, and what are your ideas on the next COP?
I'm also not so familiar with the COP processes, and I wouldn't want to sort of step on anyone's political toes. But just sort of in between the COPs and the sort of link between the international and the national level is then WHO Europe Health in Climate Change working group, where the representatives of the national governments are meeting and discussing the issues of health in relation to climate change. So in a way, there is a structure there already for the national governments. I can see that in the chat that Helen Ross made a very interesting point that health organizations are not being brought as part of the delegations. I have no idea how this can be changed, but it just reminds me of a meeting at this WHO HIC Health in Climate Change group a couple of years ago, where there was a very interesting presentation actually analyzing the makeup of the delegations at various COPs, and that in general 0.25% of the delegates were coming from the health background or something like that. So that sort of illustrates how big the sort of the emptiness or the gap is in terms of the health professionals representation, not just at the side events or not just in the green zone, but actually in the delegation. But how can this be changed?
Okay, but it's an interesting indicator to monitor, and if there are any changes, and I think it's us as NGOs or other organizations holding governments accountable to send more health people there. So I think there are leverages that can be used. We are almost out of time. Is there anything else you would like to share with the panel and with the audience? Any other ideas that came into your mind while we discussed here? Everyone happy and with the discussion, no open questions. There are some open questions from the audience that we can't tackle now. I would say we collect all of them and send them to you. Sometimes the questions are very interesting also for your work, so nothing will be loose, will get lost, so we will send them to you. Thank you very much for your presentation and also for the keynote speakers to present your work. And thank you very much also to Kim van Dalen to organize and help put together this event. That was very helpful. And I wish you a good afternoon when you're in the European region, good afternoon or morning or evening, wherever you are. And I hope to keep the discussion going in the future. Thank you very much.